The shadow of doubt, when diagnoses do more harm than good. Diagnoses are supposed to bring clarity, offering a path toward healing. But what happens when a diagnosis does more harm than good? The label itself can become a burden, casting a long shadow. This is the unsettling reality of unwanted medical diagnoses. We are witnessing the rise of overdiagnosis. Diagnosed with conditions that would never have caused harm, the emotional toll of a false alarm is immense. The fear, the uncertainty, all for naught. This is the human cost of overdiagnosis. The unwanted diagnosis, a growing epidemic. Overdiagnosis is not a new phenomenon, but its prevalence is increasing at an alarming rate. This medical paradox is fueled by a confluence of factors, including advances in diagnostic technology, the rise of defensive medicine, and our societal obsession with health and wellness. The advent of increasingly sensitive diagnostic tools, while undoubtedly beneficial in many cases, has also led to the detection of minute abnormalities that may never have caused any symptoms or affected a person's health. This has blurred the lines between what is considered normal variation and what constitutes a true medical condition. Furthermore, the fear of litigation has driven many healthcare providers to adopt a better safe than sorry approach, ordering a battery of tests even when the clinical suspicion is low. This practice of defensive medicine, while well-intentioned, contributes significantly to the problem of overdiagnosis. Adding to this complex equation is the growing emphasis on early detection and disease prevention. While proactive healthcare is undoubtedly important, the aggressive screening of healthy individuals can lead to the detection of indolent cancers and other conditions that would never have posed a threat in a person's lifetime. The high cost of overdiagnosis. The consequences of overdiagnosis are far-reaching, impacting not only individual patients but also the healthcare system as a whole. On an individual level, an unwanted diagnosis can lead to a cascade of negative effects, including unnecessary anxiety, invasive procedures, and potentially harmful treatments. The psychological toll of living with an unwarranted diagnosis can be immense. The constant worry, the fear of the future, the stigma associated with certain conditions, all of these factors can take a heavy emotional toll, leading to increased stress, anxiety, and depression. Moreover, overdiagnosis often results in unnecessary medical interventions, ranging from repeat biopsies and imaging studies to surgeries and medications. These procedures not only carry inherent risks and side effects, but also contribute to the financial burden of healthcare, both for individuals and for society as a whole. The financial cost of overdiagnosis extends beyond the direct expenses of medical care. Unnecessary treatments and lost productivity due to misdiagnoses place a significant strain on healthcare systems worldwide, diverting resources away from those who truly need them. Trapped in a medical maze. Sarah's story. Sarah, in her early 50s, faced the impact of overdiagnosis. A routine mammogram revealed a small tumor. Terrified, she had a lumpectomy and radiation therapy. The treatment left her fatigued and anxious. Later, she learned it was ductal carcinoma in situ, or DCIS. DCIS is often overdiagnosed and may not cause harm. Sarah's aggressive treatment was for a condition that might never have posed a threat. Her story highlights the human cost of overdiagnosis. Section 5. The power of prevention screening tests and their limits. The increasing emphasis on preventive medicine, while well-intentioned, has also contributed to the rise of overdiagnosis. Screening tests, designed to detect diseases in their early stages, are often touted as the key to a longer, healthier life. However, it is crucial to understand the limitations of these tests and the potential risks associated with widespread screening. Screening tests are not perfect. They can produce false positive results, leading to unnecessary anxiety and further testing. Additionally, not all diseases detected through screening require intervention. Some cancers, for example, are slow-growing and may never cause symptoms or affect a person's lifespan. The decision of whether or not to undergo screening is a personal one that should be made in consultation with a healthcare provider. Factors to consider include age, family history, overall health status, and personal values and preferences. It is essential to have an informed discussion about the potential benefits and harms of screening before making a decision. Section 6. The Second Opinion. Seeking clarity in a sea of uncertainty. In the face of a new diagnosis, especially one that is unexpected or potentially life-altering, it is always advisable to seek a second opinion. This does not imply a lack of trust in your doctor, but rather a desire to ensure you have all the information you need to make an informed decision about your healthcare. A second opinion can provide valuable insights, confirming the initial diagnosis or offering alternative perspectives and treatment options. It can also provide peace of mind, knowing that you have explored all avenues and are making the best decision for your individual circumstances. When choosing a doctor for a second opinion, it is essential to find someone who is independent from your initial physician and who has expertise in the specific condition in question. Do not hesitate to ask about the doctor's experience, qualifications, and approach to treatment. Section 7. Trust your instincts. You are your own best advocate. In the complex world of medicine, it is crucial to remember that you are your own best advocate. No one knows your body better than you do, and your instincts and observations are invaluable pieces of the diagnostic puzzle. If you are experiencing symptoms that are concerning or persistent, do not hesitate to seek medical attention. Be prepared to describe your symptoms clearly, providing as much detail as possible about their onset, duration, severity, and any factors that seem to trigger or alleviate them. Remember that you have a right to ask questions and to be fully informed about your diagnosis, treatment options, and the potential risks and benefits of any medical intervention. Do not be afraid to challenge assumptions, seek clarification, or voice your concerns. Section 8. Building a collaborative relationship with your doctor. Open communication and a strong, collaborative relationship with your doctor are essential for ensuring accurate diagnoses and appropriate medical care. View your doctor as a partner in your healthcare journey, working together to achieve the best possible outcomes. Share your medical history openly and honestly, including any past illnesses, surgeries, allergies, and medications you are currently taking. This information is crucial for your doctor to make an accurate diagnosis and develop an effective treatment plan. Be an active participant in your healthcare decisions. Ask questions, express your concerns, and share your values and preferences regarding treatment options. Remember that you have the right to refuse any medical intervention that you do not feel comfortable with. Regular checkups and preventive screenings are essential for maintaining good health and detecting potential problems early. However, it is important to discuss the risks and benefits of screening tests with your doctor and to make informed decisions based on your individual circumstances. Section 9. The importance of shared decision-making. The concept of shared decision-making is paramount in today's healthcare landscape, particularly in the context of overdiagnosis. This collaborative approach emphasizes open communication, respect for patient values, and a balance between medical evidence and individual preferences. In the realm of diagnostic testing, shared decision-making involves a thoughtful discussion between the doctor and patient about the potential benefits, risks, and limitations of various tests. This includes exploring alternative diagnostic pathways, understanding the implications of a positive or negative result, and acknowledging the possibility of overdiagnosis and its potential consequences. Empowering patients to actively participate in the decision-making process fosters a sense of ownership over their healthcare journey. It allows them to make informed choices that align with their personal values, beliefs, and tolerance for risk, ultimately leading to greater satisfaction with their care. Section 10. The future of diagnosis. Striving for accuracy and patient empowerment. The issue of overdiagnosis poses a significant challenge to the medical community, prompting a call for greater awareness, improved diagnostic accuracy, and a shift towards patient-centered care. Researchers and clinicians are continuously working to develop more precise diagnostic tools and refine existing ones to minimize the risk of false positives and overdiagnosis. Advancements in artificial intelligence and machine learning hold promise for enhancing diagnostic accuracy and reducing human error. By analyzing vast amounts of data, these technologies can assist doctors in making more informed decisions, identifying patterns and anomalies that may not be readily apparent to the human eye. However, technology alone cannot solve the complex issue of overdiagnosis. A cultural shift within the medical community is equally crucial. Moving away from the more is better approach to testing and embracing a more judicious and personalized approach to healthcare. Section 11. Join the movement. Your voice matters. The fight against overdiagnosis is a human rights issue. It's about ensuring individuals are not subjected to unnecessary harm. Share your story. If you or someone you know has been affected, share your story. Your experience can help raise awareness and advocate for change. Let your voice be heard. Don't forget to like, share, and subscribe to HealthPath Finders for more important updates.